A very good morning to one and all. I would be talking on on-site evaluation of the efficacy of artificial intelligence-based diabetic retinopathy detection in telescreening. So let me just start by giving an example of these three diabetic patients who are awaiting in a small village for DR screening. As we all know that there are more than 72 million such patients in our country who are awaiting in various villages. So the need of the hour is a very effective on-site mass diabetic retinopathy screening program. So we at Shankara Eye Hospital, we did a study to primarily evaluate the on-site efficacy of AI-based DR detection, and secondly, to analyze the impact of this system on reduction in economic and logistic burden on patients and reduce the screening burden on VR specialists. So we covered a wide area of about 47, we conducted 47 DR screening camps covering a radius of more than 265 kilometers surrounding Bangalore. So we collaborated with a private company called Lebincare who developed the AI software for us, and this is the various techniques they developed to develop the software. So we started by creating a Google form where we enter the patient details, and then using this plugin called AppSheet, which is seen on the top of the screen, we made a personal mobile application on which the optometrist enter the patient details and upload the patient images so that the VR specialist sitting at the base hospital can simultaneously view the images and grade them. So we included diabetic patients and excluded those who had anterior chamber whom we could not dilate. Patients who had media haze and prevented fundus view were excluded. Poor capture quality images were excluded for analysis. 989 diabetic patients were screened over a period of 2 years. Posterior pole dilated fundus images were captured by trained optometrists. Images were then uploaded on the mobile application along with patient data. Simultaneously, these images were analyzed by the VR specialist who was sitting at the base hospital, the optometrist at the field site, and the AI-based software on the cloud. So this is how the AI grades the image and marks the lesions on the fundus and gives the annotations of various different lesions on the fundus. And the report is displayed on the mobile screen within less than a minute. The advantage is that this can also be used to educate the patient and emphasize the need for regular screening. Out of the 1978 eyes which we included in the study, 1540 were analyzed, 438 eyes were excluded because of various reasons like cataract and poor image quality. As we can see that VR specialist grading was considered as a gold standard to compare the optometrist versus the AI grading. Moderate NPDR and above was considered as referable DR. And as we can see that the sensitivity and specificity was very good when picked up with the AI, better even than the optometrist grading, thus making it an effective tool for screening. So if we look at the first slide in which I showed the first patient, he had no DR findings on his fundus. So this saved him the visit to the hospital, his travel cost, the logistic burden, his daily wages and the consultation cost. Also the accompanying attenders cost has been saved. Similarly, the second patient also had just mild NPDR changes, so even he did not require to come to the hospital, saved his cost, and we educated him for the emphasis of regular DR screening. Whereas the third patient who had significant DR changes was referred to the base hospital. So in a country like ours where India is just spending over 1% of its GDP on health expenditure, an effective screening tool like AI where it can reach even in a peripheral centers, using this we can save a massive expenditure of about more than $2,000 million money-wise and more than 15 million hours of VR specialist spending on this diabetic retinopathy screening. Various studies have been done on AI, its utility in DR detection, but ours is the first study where it has been AI has been tested in peripheral centers in a mass screening program for community patients. So our results are quite on par with the published results in the literature. The only limitation is the optometrist needs to be trained a little bit for the optimal image capturing, and he needs to be trained a little bit about the DR image and grading identification, and the fundus image that is captured is a 50 degrees posterior pole image. So the take-home message is AI is the future. Like it has shown an impact in various other fields, even in health sector, in rural areas, in peripheral centers where there are no enough resources, it can have a great impact in DR screening programs and to reduce the blindness burden in our country. Thank you. I would like to acknowledge my team and Shankara Hospital for giving me this opportunity.